Hi, my name is Haley Rowland. I'm the Public Information Officer for the Riley County Police Department. Today is Friday, May 1st. We made it to May. We are going to be giving you an update on the local coronavirus information for Riley County. Today we have local health officer Julie Gibbs from the health department, and then we also have the Riley County Police Department Assistant Director Kurt Muldrup here to answer any questions. I'd also like to thank Tony Kroll for providing sign language interpretation for this broadcast. Julie?
All right, thanks, Haley. Hi, everyone. As of today, May 1st, Kansas has 4,449 positives statewide. There are now 534 hospitalizations, and there have been 130 deaths in Kansas. Riley County now has 51 confirmed positives, and 26 of those have recovered. We also have 60 pending tests, and there have been a total of 438 negative tests in the county so far. The newest positives include a 57-year-old female who is isolating at her home, along with a 38-year-old male who is isolating at Ascension Via Christi Hospital. If you are experiencing symptoms, please call our screening line at 785-323-6400. This is available every day, even on the weekends, from 8 a.m. until 10 p.m. Again, that number is 785-323-6400. We are still encouraging anyone with questions to please email us at rileycountycovid19@gmail.com. During business hours, we are usually able to get back to you quickly. We will still have staff able to answer your questions over the weekend as well. It may not be as quick on the weekends. Please have patience with us. Again, that email is rileycountycovid19@gmail.com. We are still working on the final touches of a restricted movement order, along with guidance and clarification to go out later today. This is largely based on guidelines from a few different national sources, as well as input from our clinical task force and the recovery task force. We have worked closely with Geary and Potawatomi counties to make sure that all three of our orders are similar in language. We want to also make sure to add in enough definition so that it is very clear to everyone what is expected. After listening to the governor yesterday evening, I think it's safe to say that we can begin to see the light at the end of the tunnel. However, there are many businesses that are still closed, and those business owners are certainly hurting. It's important at this time to stay the course, restrict your movement as much as possible, wear your mask, and continue to practice proper hand hygiene so that those businesses can open soon. We are certainly not out of the woods yet. We might see a spike in our numbers if we start to open more businesses and possibly more hospitalizations. So it's important to keep in mind that through these phases that we'll be working through, they're very fluid, and we could go back to the previous phase if need be. We are working hard as a community to keep everyone safe and informed. So many people are involved in the effort to reduce risk, and I'm grateful for that. It truly takes a team effort to make it all happen. Everyone can contribute to this effort by continuing to wear masks, practice social distancing, and restrict unnecessary travel. Thank you for being such a great community and for all of your support. I'll now take any questions you might have.
I'm also monitoring our Facebook live feed right now. So if anybody in the public has questions, feel free to input those on our Facebook page and I will get to those and we will have the appropriate person answer. Do we have any questions from the members of the media that are joining us?
Yes, this is Savannah with the Mercury. I had a quick question about the two newest cases. Is there contact tracing still being investigated, or do we know if they had been in contact with a known previous case?
We're still doing the contact tracing. These are pretty new cases, so we're still working on that.
Julie, I know one question that we've received is the timing on when our phased plan is going to be released. Can you talk a little bit about when that might be?
Sure. We're just working on the final touches right now. As you know, last week we worked through this all week last week and this week as well. We started early this morning and we've continued up until now. We will continue after the Facebook Live as well. So we hope to have something out by early this evening.
And when that plan is released, where can people find that plan?
You'll be able to view it on our website, rileycountyks.gov. We will also post it to our Facebook page.
Do we have any other questions from the members of the media?
Yes, this is Becky Goff with WIBW. And in regards to the plan to phase back in, will Riley County's plan involve 4 steps similar to the governor, or are you able to give us that information at this time?
Yes, it'll be very similar to the governor, and we do plan to do that in 4, if not 5 phases.
Julie, one of the main questions that we continue to get into our Facebook page regards barbershops and hair salons. And I know you can't give specifics on exactly what the plan is since it isn't finalized yet, but can you talk a little bit about the governor's plan and how her plan, your plan can be more restrictive than hers, but not less restrictive. And so where that leaves barbershops and hair salons on that scale from the governor's perspective?
Sure. So the governor is decided to keep those businesses closed. So therefore, we cannot allow them to open since we can only be more restrictive and not less restrictive. So we have to adhere to that. And her phases are similar to ours, 14 days. So the earliest that those businesses would be able to open would be May 18th. Now that could be extended. That is just a minimum of 14 days.
Thank you. I see a lot of questions coming into our Facebook page asking specifics on the plan. And I would just like to assure everybody that we are going to get that plan out as soon as possible. Like Julie said earlier, we were working very quickly to get that done, but we want to make sure that it's done accurately and done well because we know that that affects each of you individually. And we want to make sure that we are doing it justice. And so once we have that plan ready, we will distribute that on as many avenues as we can so that you know when your businesses can reopen and what practices need to be put into place to make that happen. Do I have any other questions from members of the media at this time? I'm getting a couple more questions on our Facebook page. Assistant Director Muldrup, would you be able to talk about some of the mixed messaging that could be going out and why we're not putting out the specific information at this time since we don't have those documents finalized?
Yeah, that's a great question. We're working hard to get accurate information out to everyone as quickly as possible. We understand that the decisions that we make in the Emergency Operations Center, or the EOC, impact everyone at every level, which is why it's critical for us to make sure that the information released is finalized. Unfortunately, a rough draft plan of our phased reopening was distributed prior to important modifications being made on it. This resulted in a lot of confusion and misinformation out there because it was a working document and not our finalized plan. We want you to know that you can count on the Riley County Health Department and the team here at the EOC to provide you with finalized documents when they're ready. That way there's no confusion on what the orders say and how they impact you and your family and the businesses. You can go to, as we said before, to the website, rileycountyks.gov/coronavirus to get our final orders, which, as we said, should be out soon this evening. You also see them on the Riley County Health Department's Facebook page, and you can tune in live for here at our Facebook Live Monday through Friday at 4:15 to continue to get updated information. It's important, though, that you come to this source for what our orders specifically are and how they affect Riley County.
Thank you so much, Assistant Director. I would like to touch again on something that Julie mentioned. Julie, you said that we could recess back to previous phases if there were certain things happening. Could you talk about that a little bit more? We're getting some more questions into our Facebook about that. People want to know how long we're going to be in each phase and if we can fall back.
Sure. 14 days is the minimum. So we have to look at it from a 2-week perspective. If we start to see a spike in our cases, and more importantly, if we start to see more hospitalizations, we can revert back to a previous phase or just stay in the current phase for a little bit longer. The governor said something similar last night. You know, if we start to open up these businesses, but we start to see a lot of a spike in our numbers, or we start to see clusters, or we start to see more hospitalizations, we can revert back or stay in that phase for a little bit longer. So it's very important that we continue to restrict our movement. You know, this is no longer a stay-at-home order, so we're not going to use that language, stay at home, but that's kind of what we mean. You know, you need to stay at home, and unless you need essentials. That's still kind of what we're trying to get at here. You know, if you do need to go out, make sure that you're wearing your mask. It's okay to go out and get a few things, but get those things and then come back home. We're still not at a point yet where we can congregate in groups, where we should go out and enjoy other people right now. We still want to try to reduce our risk of exposure. So really adhere to those things and just proceed with caution. Like I said, we're not out of the woods yet, so we need to make sure that we're still practicing our social distancing and practicing good hand hygiene. And hopefully those are things that we just continue to do from here on out.
Hopefully that's part of our new normal that we're starting from here. Assistant Director Muldrup, we are getting some questions in on how to report if there are people who are not following the current order and then future orders. What should be the steps that they take to report those people?
Yeah, if you have something that's currently going on and it's honestly kind of an urgent situation, you need to go ahead and call the police department. The administrative line is 785-537-2112. You can also email, as everyone has been able to email all during this time, now I forgot the email address. Want to help me with that, Julie?
Riley County COVID-19 at gmail.com.
Right, can email that, and they'll answer some questions or they'll forward it to the police department. Again, that's only staffed during the day and evening hours, so overnight we won't get those until the next day. So if it's something that's urgent, go ahead and call the police department at the administrative number. We ask that you not call 911 because we do want to save that for emergencies. And as we've said in previous broadcasts, we do want to encourage people to call 911 when they have an emergency, when they need EMS, to go to the hospital when they need to go to the hospital, and not to be concerned that during this COVID crisis, they shouldn't be doing those things, that they're bothering us. That's business as normal there.
Thank you so much. Yes, and just to reiterate that, the dispatchers for Riley County are here. They are working. They will take your call any hour of the day. So do not hesitate calling 911 when you need emergency medical services. You need to make sure to get those services to you as soon as possible. I do have another positive update. The Pottawatomie County patient that was in Via Christi has been released. So there is currently one patient in the hospital at Via Christi, and that is a Riley County resident. We do still have our survey open until 5 p.m. and that survey, we've gotten some good responses on it. There's about 3,300 responses that we have received on the survey asking about health. This is for people who did not test positive for COVID or have not been tested. This is for the general population so that we can get a better determination on resources that we may need for future instances. Do I have any other questions from members of the media? We do have a couple of Facebook questions that I'd like to address. Is there certain criteria to determine areas that are considered hotspots for COVID?
You can always check the KDHE website. They do have a link on there that links to the spots that are considered hot spots. Also, if you have some time, you might also want to check out the map on the KDHE website, which is updated daily. It will give you an indication of how many cases are in each county.
Thank you, Julie. We have gotten some questions on our Facebook page about the local order and about the guidelines that it's going to spell out. Can you talk a little bit about how that works with the orders, with our order, with the governor's order, if the president issues an order? Could you talk a little bit about how that goes and which order people should follow?
Sure. It's we have varying levels of orders. I think everyone has kind of seen over time that comes out. You have a national order that comes out from the White House. Basically, those are guidelines or recommendations that are intended to be broad and fit the entire nation. And then each state, specifically ours, the governor's office, issues executive orders that are, again, intended to be broad for the entire state. Local orders are then issued by each county, and those generally can be more restrictive than the governor's order, but not less restrictive. And that's been pretty much the case throughout this, except for the most recent order. We couldn't vary from it at all. But the current order that will be coming out can be more restrictive, but again, cannot be less restrictive. But they'll be, our residents will be required to follow the local health officer's order, which will be very clear.
I just want to add to that. It was kind of mentioned before, but one reason why it's taking us so long to get through that is because we did want to wait on the governor's order that we were all able to view last night, and then have some time to sift through those guidelines that she also put out with that, so that we are similar in our language and our order. We also wanted some time to connect with our counterparts in Erie County and Pottawatomie County to determine what exactly we're going to put in those orders. As you all know, we do have some businesses that are considered in Manhattan, but they are across that Pottawatomie County line. So we want to be similar with what Pottawatomie County is doing, as well as Erie County. So that's why it is taking us a little bit longer. And we want to make sure that we have all of the guidelines in place for you. Like I mentioned earlier, we want to make sure that that's spelled out for everyone so that reduces the amount of questions that you might have.
I'd also add that during that time, we also provided our plan and a lot of the ideas that we were looking at, our orders, to the Recovery Task Force here in town. And so that has a large 24 different people on it, representing all the business community, and other counties on it, so that we can get their input as well, so that we can tweak it to make sure it fits what really is needed here in Riley County. And then, as Julie said, also will coincide as best we can with Pottawatomie County and Geary County.
Thank you both for clarifying on that. We do have a lot of people in our comments asking about the specifics of the phasing plan. And I would just like to let everybody know that starting next week, there is going to be a question and answer hotline available for businesses run by the Manhattan Area Chamber of Commerce. And so if you would like to ask specific requirements for businesses, that should be directed to that Q&A hotline. And I can give you that number. It is 785-776-8829. I would like to say that is not operating currently. It will start next week on Monday and will run from 8 a.m. to 5 p.m. And that will be for the businesses who are reopening during this next phase, so that they understand the requirements that they need for their business to stay open. Again, that number is 785-776-8829. There's also an email address if you're more comfortable with email, and that is info@manhattan.org. And again, that is for businesses who are wanting to get specific guidelines and best practices to stay open during the next phase.
And I might point out too, that take this opportunity that doesn't open until next week, because the current governor's order is still in place through the weekend. So there's no confusion. It doesn't expire until midnight on Sunday night. And then our order, the local order, which will be out before then, so people will have time to view it and see what the differences are, will be out again sometime this evening for sure. But the current order, the current stay-at-home order, is in play for this weekend. I know that's going to be hard for people because they're looking at the plan that was leaked out as well as what the governor has said. But even the governor's new order doesn't take effect until Monday.
Thank you so much for pointing that out. All right. Unless there's any other additional questions from the media, I'm not seeing any new questions coming into the Facebook page. Do we have any other additional questions at this time? Julie and Assistant Director Muldrup, is there anything that you'd like to add?
Just like to add, please try to have a good weekend. Maybe get outside a little bit and take your mind off COVID for a while.
And we're going to leave here or leave the Facebook Live and get back to finalizing those orders so you guys can have them as soon as possible.
All right, thank you so much. And as we talked about earlier, those orders should be available later this evening. As soon as they are ready, we are going to get those out to you so that you have those documents and you can read through them and know what what's going to be put into place for Monday. Like Assistant Director Muldrup mentioned, we are still status quo for this weekend. Everything is still as it was. And so until you receive those new orders, please continue to follow that guidance that was already given and to continue the stay home order. Thank you so much, everybody, for joining us. If you do have any other questions, you can feel free to email us at rileycountycovid19@gmail.com. Have a great day.